So today I'm going to explain you about the life cycle of the malaria parasite, that is the Plasmodium. So there are different types of malaria parasites. Mainly about 60 to 80% of malaria infection is caused by Plasmodium vivax. And there is also the most virulent factor, that is Plasmodium falciparum, and also there is Plasmodium malariae and Plasmodium ovale. And also there is another type, that is a zoonotic type called as Plasmodium knowlesi, but recently it is found that Plasmodium knowlesi is also causing human infections. So when you come to the life cycle, there are two parts, that are two hosts in the life cycle of malaria. So normally there are two types of hosts, that are the definitive host and the intermediate host. How we define the host? So a definitive host is the host that having the sexual part of the life cycle of that parasite. So in malaria, the definitive host is the female Anopheles mosquito, and the other type is the intermediate host. So intermediate host has the asexual phase of the malarial parasite. So in malaria, the intermediate host is the man. So when the female Anopheles mosquito bites a man, they push saliva into the skin, and through the skin there is anticoagulants coming to the blood, and also along with this saliva there are sporocytes of the malaria parasite that is coming into the circulation. So these sporocytes find their way through the blood into the parenchymal cells of the liver, and through certain receptors these sporocytes then enter into the parenchymal cells of the liver, and in this parenchymal cells they become round in shape, and gradually the nucleus of this Plasmodium vivax, it divides and it forms several nuclei, and also the cytoplasm of the Plasmodium, it divides around these parts of the nuclei, and now this process is called as schizogony. After several processes, the nuclei divide into several parts, and the cytoplasm get together around these nuclei, and it forms a lot of merozoites inside the cell of the liver. Now this is called as the exoerythrocytic schizon. Then this mature exoerythrocytic schizon, it ruptures and it releases all these merozoites into the circulation. And these merozoites, they can enter into the red blood cells, but we have to keep in mind that these merozoites, they never re-enter hepatic parenchymal cells. And also the part of the phase, life cycle phase in the liver, we call this as pre-erythrocytic phase or exoerythrocytic phase. When the sporocytes enter the parenchymal cells of the liver, some of them can remain dormant, and these are called as hypnocytes. These hypnocytes, they will remain dormant, for an example in Plasmodium vivax, for about 5 years, and after that they can get reactivated after 5 years, and when they get reactivated we call it as relapsing of the malaria. And after that, now these merozoites are released into circulation. One merozoite of Plasmodium vivax, it enter one RBC. But in falciparum, several merozoites can enter one red blood cell, and we call that polyparasitism or multiple invasion, and it causes for the high virulence of the Plasmodium falciparum. Now, in the red blood cell, it undergo different phases, mainly ring stage, amoeboid stage, or the tropozoid stage, and after that it undergoes the schizoid stage. So in Plasmodium vivax, we can find all these stages in the circulation, peripheral blood, but in Plasmodium falciparum we cannot find amoeboid or tropozoid stage or the mastocytosis stage because they get sequestered in the deep visceral blood vessels. So this merozoid, it get developed into a ring stage. That means it has a eccentric nuclei, and the cytoplasm, it get around and it forms a ring shape, and there is a thick ring of cytoplasm in this ring shape. And these Plasmodium, they use hemoglobin for take their nutrients, and after that they produce malaria pigments, and they are called as hemozoin. And also in the cytoplasm we can identify red color dots, and they are called as Schuffner's dots, and this producing of Schuffner's dots we call this as stippling. And after that, this ring stage gradually develop into the amoeboid stage, and the cytoplasm, it get enlarged, and also the RBC also get enlarged. It get enlarged for about 1.5 of the normal size of a RBC. Then gradually the nucleus get divided again, and the cytoplasm get gathered around these nuclei, and again they form merozoids inside the RBC, and we can see the Schuffner's dots and clearly in the mature schizon too. After getting mature, the schizon get ruptured, and again it releases these merozoids in circulation, and these merozoids can again enter RBC. So developing of these young merozoid into ring, amoeboid, tropozoid, and schizon stage, and to rupture, it takes about 48 hours. So when these 48 hours get fulfilled, it causes fever in a malarial patient. That is why they get different types of malaria fever, like tertian malaria and quadrant malaria. Some of the merozoids, after entering the red blood cell, they don't undergo further development, but they undergo the producing of gametocytes, and they enter the sexual phase. They produce female and male gametocytes, and these gametocytes are taken up by the female anopheles mosquito. And the sexual phase of the malaria parasite then again get developed in this definitive host, and after this female anopheles mosquito bite another person, they release these sporocytes again, and this develops as a cycle, and it get infect another person.